to this episode Beyond the Mirror. Today we hear a lot of advice about wellness, longevity and health. And to be honest with you, a lot of this advice comes from people with no credibility or real knowledge of insight. So I invited on this episode a real expert to give you the true answers. And I'm very proud to welcome Dr. James Brown, who is a lead physician for UK Athletics. James, can you please tell us a little bit about your job and what is involved?
Yeah, sure. So thanks for inviting me. I have to say it's my first podcast, so I have to bring a few notes with me, Ollie. So
That's
you don't
absolutely
mind.
fine.
Good. Yeah, so what do I do? I've worked in elite sport for a lot of years, probably around 25. And so essentially I'm responsible for the health, physical and emotional health of our track and field Olympic athletes. So our main training centre's in Loughborough, which is where I'm based, but our athletes train all over the world. So I spend my day talking to people an awful lot, understanding why they have issues, trying to solve those issues, and also advising them around rehabilitation, around injury management, but also around their mental health, and I also spend an awful lot of time doing diagnostic imaging. So this, when you asked me to do the podcast, was a little bit of a deviation from my normal work at that elite level, but hopefully we'll get some good common sense information to your audience about what it's all about.
I think the nature of your work and depth of knowledge is so valuable that I think it will be very good for people to hear from real expert rather than from someone who tried something themselves and it worked for them. I think science and evidence-backed science is so important.
Yes.
So, James, let's start with just a general question.
Yeah.
So, what an ordinary person out there can do to optimize their health and living a healthy life and be able to enjoy it?
Yeah, so I think that's a really good question, and it's interesting because very recently a good friend of mine who's similar age, they're in their early 50s, they said, oh, I need to overhaul my life. You know, they rang me up and said, can you help me overhaul my life? And I said, oh, I'll try. And I think the question is, where do people start? Right? Where do I actually start? And I think right now in the world, like you were saying, there's so much noise around, should I be keto? Should I do cardio? Should I do cold plunges? And maybe I should buy a watch to track everything. And people are overwhelmed. And I don't think people quite know now what they should do. So the truth is that you don't need an overhaul. You need a routine. You don't need a revolution. I think most people who have not exercised, let's say, before, but feel like they need to do something, they try and do everything all at once. So it's a very typical thing that you make a New Year's resolution.
Yeah, absolutely. Everyone
you say,
does.
okay, I'm going to give up all the foods that I've eaten over Christmas. I'm going to get a gym membership. I'm going to go out. I'm going to get all my gear. I'm going to cut my carbs. I'm going to drink this juice or that juice that I've seen on social media. I'm going to meditate, and I'm going to do everything in the same week. And what happens is a couple of weeks into that, they're sore, they're tired, they're discouraged, and they quit. And it's not because they failed, it's because basically they started with something that was just unsustainable. So radical change, Olha, it needs willpower. And willpower is a bit like a phone battery. Gradually over time, it depletes. So if your plan needs you to have 100% willpower 100% of the time, it is literally unsustainable. And sadly, a lot of people start and then they give up and they say, you know what, it's not for me. So what can we actually do to
Yeah,
start? If you
I'm quite keen to know.
Okay, well, the first thing I think is stop trying to be perfect. Stop trying to do everything all at once. Try to be consistent. If you can be consistent with something, and by that I mean if you can see it through for at least 6 months, then it's worth doing and you'll be able to do it. The first thing to do, I think, is to think about what are the things that are really important. And there are three things. The first thing is sleep. The second thing is any kind of movement. And then the third one is quality of food that you're eating. So you don't have to count every calorie. You don't have to do hardcore workouts. You need to start saying, am I sleeping at least 7 hours a night? Can I get 7 hours sleep?
And may I just ask a
can.
little bit question
Yes,
along
sure.
the way, because you're saying 7 hours. You hear from some people they saying I sleep 5 hours, but I'm in deep sleep. It's enough for me. Can we just trust their advice, and is it sustainable long term?
Yeah, the people like that potentially are tracking their sleep with various types of application, and they've been doing it for a number of years. So they've built up consistency. They haven't just suddenly said, oh, I can sleep 5 hours and I'm fine. They've trained themselves to be able to survive on that amount of sleep. So they didn't start there. They started a few years ago, gradually making some changes. And if that was fine for them and they built that consistency, that's okay. It isn't for the everyday person. Everyday person just needs to start somewhere, and it's not like that. So sleep is important, at least 7 hours a night. Am I moving my body? Am I doing something every day? Am I being consistent? Or are there some days where I just don't do anything? So it's easy just to get up in the morning and do something. If you got up 20 minutes early, let's say, than normal, and had a walk for 20 minutes, if you just do that over 6 months, you'll see some big changes.
What about that people just being tracking, oh, I need to do 5,000 steps, I need to do 10,000 steps. Is any guidance on
We'll
that?
come on to that, Olya. I think that's a little bit later in there. What we're doing now is we're just establishing what can I do to
Yeah.
build some consistency. The third one that I talked about was the quality of the food that you're eating. Now, it's not rocket science. Food is, if you cook it yourself, if you prepare it, if you use a lot of green vegetables, a lot of protein, not so much refined carbohydrates, like the nice almond croissant, if we reduce those sorts of things, then that allows us to build a little bit of consistency. So are we sleeping okay? Are we doing a little bit of activity every day? And are we able to eat a little better? Because we all know what we should and we shouldn't eat. It's not that's not the question. It's can you sustain it? And if you try and do too much too soon, you won't be able to sustain it and you'll give up.
I also, James, hear often from my patient, obviously my area of expertise is static, but it tend to be that women talk about wellness and health and what they do on day-to-day basis. And I hear more and more often that people use this tracking app when they scan food in the supermarket when they buy it.
Yeah.
And I personally don't do it. I go by the guide. Is it grown in the garden? Did it came from the land or sea?
Yeah.
Then it's a healthy.
Yeah.
If it's come in the pack, which full of different ingredients, I personally think that is probably something there that I shouldn't be eating every day.
Yeah.
So is there any guide on that as well?
Yeah. So
Would you agree with the scanning apps that gives you information on what on the food and how it's impact your body as a doctor and as an expert in your field?
What would I suggest in that area? I think, like you were saying, if you can pick something off a shelf, like some vegetable, for example, you know what it is. It's a piece of broccoli, it's a carrot.
You don't need a scanner.
You don't need a scanner to be able to do that. But it does take a little bit of time to cook that food and to prepare it. If you buy something that's ready-made, they often will contain quite a lot of processed food, and food which is higher in sugar content, let's say, for example. The downside of that type of food, Olya, is that it bypasses your body's ability to understand whether or not you're full. And we'll come to that a little bit later when we talk a bit about what are the medications that are helping us to reduce our need to have something sweet, for example. But we will come on to it. But I think, just in summary, basic foods that you can prepare yourself. A lot of colour on your plate is great. Reduce maybe the amount of starchy carbohydrate and increase the amount of protein, whether it's fish, chicken, whatever it may be, or vegetarian protein, it doesn't really matter. But those are the sort of typical things I would say. It's okay if you want to scan something, if you want to do that, I think that's okay. Just watch the amount of processing that food's gone through and the amount of sugar as well. So, hopefully that's kind of given us a little bit of an introduction into getting going, because I see a lot of people who they've got an awful lot of willpower, they think they have, but they make too many changes and those changes become unsustainable and therefore the consistency levels drop and you end up going up and down and up and down instead of obtaining a balance, which is really what we're trying to do.
I think it has been fantastic start and very dive deep in depth inside. I think it's great. Thank you, James. And my next question is I think comes right from your professional field and the elite athletes that you're working with. What does the regular exercise role in our overall health? And doing, for example, 10-15 minutes every day, is it really enough? And does it make any difference?
So let me be really enthusiastic about exercise because, as you say, I work with elite athletes. These guys exercise 6 to 7 hours every day. They may have a day off in the week. But I'll be honest and say, if you could bottle the effects of regular exercise into a tablet, it would be the most powerful drug in history. And that is a fact. So what can it do? What actually does it do for you? Well, it reduces your risk of pretty much every chronic illness. Heart disease, type 2 diabetes, stroke, depression, anxiety, osteoporosis, Alzheimer's, and even it may reduce the risk of certain types of cancer. So when you exercise, it's not just about achieving fitness. It's not about fat loss. It's about staying healthy for longer and staying well while you're alive, So how does it do that particularly? Let's look at type 2 diabetes because it is a big problem in the developed world. So what happens when you exercise is it improves what we call insulin sensitivity. Now, I know it's a bit of a technical term, so I'll try and explain it. When you eat a meal, for example, your blood glucose levels, and we all know what glucose is because in diabetes, blood glucose levels are high. In a normal person, they're controlled. But when you're exposed to the types of diet that we were talking about earlier, which are processed foods, high sugar content, and by the way, a lot of low-fat products take away the fat, but they increase the amount of sugar to improve the taste. I don't like low-fat products, but anyway.
Neither do I.
Good. So you have your meal, your blood glucose spikes, it rises up. And we all know this, right? We know that if we eat a donut, our blood glucose level is going to spike. But if you do that on a regular basis, what happens is your insulin sensitivity decreases. So to counter that, exercise is good. Insulin, basically, what does it do? It's like a key, Olya. So when your insulin level rises, which it does after you've eaten, the insulin level rises and it opens up the cell to allow glucose to enter. So it goes out from the bloodstream into the body, maybe taken up by muscle, maybe taken up by the liver. Now, if your insulin sensitivity is low, that means that the key doesn't work very well. So the consequence of that
is that glucose stays in your bloodstream and it attaches itself to hemoglobin, which is the oxygen carrying compound in your blood. And so you may have heard that, I've got a raised blood sugar over a long period of time. And that is because your body has become less sensitive to insulin. And by adopting a more healthy diet that we talked about, and by regular exercise, that helps the body become sensitive and it allows the insulin to unlock the cell, moves the glucose out of the blood, which we don't want it to be in there, and into the cells to be used. The other thing that insulin will do is if your insulin sensitivity is low and your blood glucose levels are high, it tends to mean that glucose is transported into visceral fat, which is fat around your organs. So if you're exercising, you're reducing the amount of glucose in the blood, you're moving it away to be used as energy in muscles, stored in the liver as glycogen, and therefore you're reducing the risk of type 2 diabetes, reducing the risk of heart disease and the other conditions that I was talking about. So what else does exercise do apart from that? And that's a big thing that I want people to understand. Exercise helps to regulate your blood pressure. It helps to raise your good cholesterol and reduce the bad cholesterol. It improves brain function. We were talking a little bit earlier about why do some people feel better in themselves after they've exercised, and that has got to do with a substance called brain-derived neuroreceptive protein, and this essentially is temporarily increased when you exercise, and it's a kind of brain food, if you like. It helps your brain cells connect with each other, and you feel better. So here's a little tip: if you are planning on a discussion with your partner about something serious, it's better to do it after you've exercised, both of you, because you'd be a lot more happy to be calm and have that discussion. So it has multiple benefits. And you said to me earlier, what about the numbers? A recent study in British Journal of Sports Medicine said 11 minutes a day of moderate intensity exercise. Do you know what moderate intensity exercise is, just out of interest?
Well, it will be to do with increasing your heart rate, isn't it? So, or
An easier way is actually, because we don't all track our heart rate,
Yeah.
okay?
I do.
You do, okay, so that's great. But an easier way, if you don't have a heart rate tracker, is to say this: if you can walk and sing at the same time when you're exercising, it's light exercise, we call it. If you can talk but not sing when you're exercising, it's moderate. And if you can't talk or sing, it's pretty vigorous. So that gives sort of everybody an understanding of, okay, what levels are they? So I talked about moderate exercise. So moderate exercise means for 11 minutes while you're exercising, you can still talk, but you can't sing. And if you do that every day, 11 minutes a day, that is super beneficial. And we'll talk about actual benefits later on in the talk. So 11 minutes is all you need.
That's only 70 minutes, like 80 minutes a week, which is...
And that is what we call sustainable. And that's what we talked about earlier. Where do you start? You start being sustainable. You make some small changes, and that is a small change. It's achievable, but you will see benefits. But it takes a few months. There isn't a quick fix. You're trying to change your lifestyle. You're not aiming to get yourself ready to go to Marbella in the summer, because you go to Marbella, you have a great time, you come back and you're back to square one. So this is all about being consistent, changing your health, changing your lifestyle, but in a sustainable way.
I think that is incredible. For example, I'm surprised how little exercise you literally need to do to make a change. Because I personally exercise, I try to do 3-4 times a week.
Yeah.
on the weeks when I'm busy twice a week, but like 40 minutes at the time. And I was convinced that I'm not doing enough. I wanted to find more time in my schedule to allocate it more to the exercise. And it's a really interesting fact. So guys, you don't need to do too much, just consistency.
Consistency is the key. And of course, you will start with this and gradually you can increase. But let your body get used to what you're asking it to do first. Don't try and do too much, because the body will say, do you know what? I don't want to do it. I'm not ready yet. So take your time when you're doing this, when you're getting into this routine. We talked about some physical benefits, Olya. There's an awful lot of mental health benefits as well. It triggers release of various types of endorphin, dopamine, serotonin. It helps to make you feel less anxious, less low in mood, and it improves your focus, your memory. And we talked a little bit about that. And interesting in people who have ADHD, and certainly there's an awful lot of that being diagnosed at the moment.
Yes,
I think,
terrible.
It is what it is. But what we know is that actually, if somebody does have ADHD, they're more focused and able to communicate after exercise. So that's a tip for people. If you know somebody who has ADHD and they're struggling to focus and talk to you, go out for a brisk walk together and then sit down, and you'll find it the person's a lot more focused.
I can't agree more with you, James. I'm great advocate of exercise. That is something that I think I have been lucky that it stayed with you throughout my life. Like I was brought up with the way of loving movement and exercise. But I think sadly the world, how it is today, is not many people have an opportunity to know the truth, reality. And you mentioned about ADHD and other mental health conditions, for example, like depression. And women during menopausal stage, they are prone to developing depression. But I just don't know how well enough our national health system inform them and put them towards their natural resolution in terms of changing their lifestyles and doing exercise, rather than took a road of traditional prescription medication way. So
I think that is a fascinating topic, Olya, and it's probably a podcast on its own.
I agree with you.
To go into that kind of level
Yeah.
of detail to help people, because I think it's an important one to cover. Maybe not for today, but for certainly to go
But
on.
I'm very glad that you mentioned importance of it and how it's impact multiple health problems.
Yeah.
And what ordinary person can pick up from professional athletes in terms of regeneration and recovery of their body? How do they approach that process, and what we can do in our day-to-day life with that?
Well, first of all, let's be real. We're not training as an Olympic medalist. We don't dedicate 4 years of our life to one goal. That being said, there's a lot we can learn from elite sport, not by copying it, by understanding how the elite athletes think about rest and regeneration. So here is the thing. Elite athletes that I look after are the fittest in the world, in the planet. But they spend more time on recovery than your average gym goer does exercising. And that puts it into context of how important recovery is. So it's not a luxury recovery, it is a training tool. So one research paper suggested that superior performance is built through hard training, but also hard training only works when it's paired with adequate recovery. So in elite sport, recovery is of super importance. The dangers of skipping recovery are, especially in high performance or high stress, is we end up with chronic fatigue, poor sleep, hormonal disruption, our cortisol levels can increase, And eventually it ends up with burnout, overtraining. Now, we see overtraining in elite sport, but it's not because they've trained too much, it's because they haven't recovered enough. So there is always a very fine balance between training and recovery. Really important in sport. And even at the elite level, I still see athletes who are overtrained. And my mantra to them is, how well do you recover? I know you train really well, but how well do you recover? And so we spend a lot of time helping the athletes develop a routine. Most of them have got it really good. Some of them just need a little bit of additional help. But these are elite athletes. And
So what
we are not
ordinary people can do.
Yeah, exactly. So we are ordinary people. So we talked earlier about a few things. We talked about what are those basic things that we can start to change, and sleep is the best recovery tool out there. Nutrition, it's important. Having a lot of green things on your plate, they contain substances that the body needs to recover. If you're training, then we normally time our intake of protein, let's say, after the exercise itself. We may take a little bit of carbohydrate before, depending on how long we're planning to exercise. And then active recovery. So active recovery means doing some sort of movement at a low intensity where you can talk and you can sing, allowing the body to move, but allows the blood flow to remove some of the toxins that you build up, not toxins, but things that you want to remove after exercise. So they're physical things. Athletes also spend a lot of time doing psychological recovery. Training as an elite athlete is tough. It's really hard. Not just physically, but emotionally as well. It takes its toll. So rest, mindfulness, naps, removing technology, not watching your podcast.
Don't take this advice.
Downtimes, things that are not geared to performance, hobbies, just going out and having a look at the nature, social interaction without the use of social media. And then other things athletes might use, we call these environmental or strategic things. Sauna is great. There are loads of research from Finland. In fact, my partner is Finnish, and most Finns have a sauna in the home. Whether they live in an apartment block or in a house, there will be a sauna there, and it's a common practice. So sauna 4 times a week, very common for our athletes. If I go to the gym in the sauna, I'll often see them in the sauna, and they're recovering. Contrast therapy, heat versus cool, hydration protocols, make sure that your fluid intake is good. And then periodization of training. So you can't train hard every day. Like I said to you before, you won't adapt, you will not achieve what you want to achieve. So hard days followed by low intensity days. And then the final one to say is listening to your body. You have to get to know when your body's telling you to stop and to slow down. And in the world we're in, those cues are often missed because we either don't think we have time or there's something that's come up that we have to deal with. But listen to your body. When it tells you to slow down, really slow down. It's a message that you need to get used to. And athletes learn this over time. It's a bit like wisdom. It happens over time.
Well, I think it's very useful and practical advice. Today we're also overwhelmed with supplement market.
We are.
And we hear that we need to take so many, and there is a big social media posts and campaigns about NAD+, and some people see one supplement as a solution for all the problems, others take multiple. So What is the reality? What the ordinary person who eats, let's just say, a balanced diet and don't have underlying health condition needs, because we know that athletes for high performance, they do take supplementation regularly and it's actively encouraged, but what the ordinary person needs?
Okay, we'll be very honest here with this and say the supplements are everywhere. It's a multi-billion-dollar industry. So even in the supermarket now, there are a plethora of vitamins, minerals, supplements, protein, you name it, it's there. And like we talked about earlier, a bit like when you've not done something before and you think, actually, I want to maybe start doing something, whether it's exercise or changing your diet. It's overwhelming. What do I take? You may watch or you may read something that says, this is the answer to your fat loss. This is the answer to feeling great. This is going to improve your brain function. This is going to improve your mood. You'll feel better about yourself. And you could easily have 12 or 13 things that you take every day, all promising something, better sleep, better weight loss, longevity. But here's the truth. Most people do not need many supplements at all, but some are worth it. And some are based on science, not hype. So I'll talk to you about some of the supplements I think are useful and why they're useful. Vitamin D3 is essential, especially if you're living somewhere where you don't get a lot of sun exposure, like in the UK between September, let's say, or October and March. Let's face it, the days are short. You don't get a lot of sun. No, people don't like to go out, it's cold or it's wet or whatever. And so your vitamin D, which you normally absorb through the skin in the sun, you don't get it. So where else can you get it? And why should we have it? Well, first of all, it's essential. It helps with our immune health. It helps with bone. It helps with hormonal balance. And it helps with our mood. Most adults need around 1,000 to 2,000 international units per day. Whenever you buy a vitamin D sample, it will tell you it'll either be micrograms or international units. So you need around 1,000 to 2,000 a day. In the summer, if your job's outside, you're getting plenty of vitamin D. You're probably getting 10,000 international units a day. In the winter, unless you eat a lot of oily fish or you take something, you're probably not getting enough. So my advice, very basic, is between September or October and March, take 2,000 international units of vitamin D per day. Do you have to spend a lot of money on it? No. You can go and get it from your supermarket. A generic product of vitamin D3 is absolutely fine. Next, I would say magnesium. So magnesium supports an awful lot of different body systems. I won't go into detail. It's around 300. But it definitely helps with sleep. And sleep, as we were talking earlier, is a really big recovery aid. So magnesium, I would say, it's an important one. If it's not in your diet, sometimes you may not take it in your diet. Then start with 200 to 400 milligrams at night. It should help you sleep, helps with muscle, nerve, a little bit of stress regulation as well. And an interesting thing about magnesium is not brilliantly absorbed orally, so you can use a spray. And some of our athletes use magnesium at night. They spray it on the sole of the feet, and the skin absorbs magnesium quite well. So you might have heard of Epsom salts, baths. They're rich in magnesium. It gets absorbed through the skin. So maybe one of those a week is absolutely fine. And then something that is there, and this is more of a performance thing, is creatine monohydrate. And our creatine monohydrate has been around probably since the early 1990s. It is a safe ergogenic aid. When I say a safe ergogenic aid, I mean it will improve your performance, and it's safe. It's not banned. Obviously, we don't deal with anything like that. But there's been a lot of research into creatine. And creatine essentially regenerates energy as ATP. It's a high energy compound. It regenerates it quicker. So for example, if you're exercising, doing anaerobic stuff, so you're really working hard in the gym, let's say, lifting weights, the creatine will give you an additional rep or two. So it allows your body to regenerate high energy fuel quicker, so it gives you an additional rep. And is that all it does? Because, you might say, well, I don't really want to bulk up, or I don't want to get huge muscles. It's also beneficial for brain health. And it's going to be used more in cognitive work as well as for performance. So creatine monohydrate, I would say 3 grams to 5 grams a day is absolutely fine, and there's no ill effects as far as I know. Another one would be omega-3 fatty acids. Omega-3, 2 to 3 servings of oily fish. If you eat a lot of fish a week, you're getting plenty of omega-3. If not, and that's salmon, sardines, for example.
May I ask you a question here? So we talk about metal particles, mercury in the sea, and that the fish that we're getting from the sea is sometimes can give us more harm if we eat too much. And if it is farm produce, then we question their nutritional value. So what's your professional opinion on
my
that?
opinion on that is that if that's what you're concerned about, then I would suggest that you looked for sources that didn't contain that.
Okay.
But I think the benefits maybe outweigh the risks in that area. So why is omega-3 good? I think, it's all about brain function, heart health. Omega-3 reduces long-term chronic inflammation. So how much do you need? Around 2 grams a day of the EPA and the DHA. Now, the EPA and the DHA come from oily fish, some types of algae. There is another linoleic acid. It's called alpha linoleic acid. It's in nuts like walnuts. And that the body can convert it into EPA and DHA, but it's not as easy. So you're better getting it from a supplement. So I take omega-3, for example.
Me too.
Good. All right. And then those are the kind of basic ones. The rest of it, I would say, is, and I'm talking maybe about multivitamins and excess B vitamins or whatever it is. I would say in this situation, don't guess, test. What I mean by that is, if you are looking and saying, oh, maybe I should have B vitamins, or maybe I should have some zinc, or maybe I should have some of these minerals, don't guess, test. Get a blood test. And we'll talk maybe a little bit later about the types of blood tests that are useful. Get a blood test to tell you, well, are your levels actually too low or not? Is your iron or your ferritin level too low or not? Do you need additional iron or not? Do you need additional B vitamins or not? And the truth is that you probably don't need them. But if you are going to take them, I would test yourself first. Because sometimes you can overdo vitamins. You think, oh, vitamins are good for me, I'll take them. Maybe you're taking too much, and too much of anything is not good. So check your blood work, vitamin D, vitamin B12, ferritin, look at your diet, and also ask yourself, what is the goal? Supplements should support a need, not mask other things like the fact you're not sleeping well, you're stressed, and you've got gaps in your diet. You can't fix that with supplements. So go back to basic stuff.
Mm-hmm. Fantastic advice, James. And I just think let's just not move to the next question. Let's just dive into which blood test do you recommend and for which age group? Because I would say maybe younger person need less often checks in comparison to the person in their 50s and 60s.
Okay, so blood tests. They're more common now, they're readily available. There's a number of places that you can go and have your blood tested, whether it's a home venous sample that you collect yourself, or whether you get a blood draw done from a local clinic. People are interested about, what is my chemical health, what's my inside health looking like? And blood testing can give you some interesting and useful information. But what is it that we want to test? So you mentioned different age groups. I'm going to talk a little bit more about blood tests that will impact you in terms of your lifestyle.
Perfect.
Okay. So First of all, standard NHS tests are a great starting point, and this would be at the advice of your general practitioner. Your general practitioner is very well trained in medicine and will know when to test somebody should that need arise, but they don't necessarily test for the sake of it. And it also may be some time before you can get in to see your GP. So what can you do? Well, the first thing is, and we talked about this earlier, metabolic health markers. We talked about insulin sensitivity and the fact that we don't want the blood to be full of glucose. And how do we know that? So you've heard of blood glucose testing.
Yeah.
A blood glucose test will give you a value of today. Yeah? And that's not useful. What is useful is, well, what has my blood glucose level been over the last 3 to 4 months of my life? And there is a test, we call it HbA1c. HbA1c essentially gives you a 3-month picture of blood sugar control. What is it measuring actually? It's measuring the amount of glucose that's attached to hemoglobin. The more that's attached to hemoglobin over a long sustained period means you are at risk of developing type 2 diabetes. So you want your HbA1c test to show that actually your blood glucose level over the last few months is nice and low because you've moved all of the glucose into the cell. Your insulin sensitivity is good. So HbA1c, what's a good measure of it? About 5.4%. Anything above 5.6, you're looking at diabetes type 2, something like that. Or pre-diabetes, should we say. Actual diabetes is more than 6.5%. So if you're around less than 5.4%, perfect. What else? Next test I would do would be a lipid panel. So lipid panel, we talk about cholesterol. It's a bit more complex than just cholesterol on its own because there's good and there's bad. There is a test called ApoB, and ApoB is giving you a much better understanding of the amount of bad cholesterol in your blood. So ApoB with a lipid panel gives you a better understanding of your cardiovascular risk. So you don't want a lot of bad cholesterol in your blood, you want a lot of good cholesterol, low amounts of ApoB. Other tests that are useful, I would say, long-standing chronic inflammation is a problem. And we measure that with high sensitivity CRP. It's called C-reactive protein. It's basically a marker of long-term chronic inflammation. So that is a useful thing because it may say to you, you're sleep deprived, you're stressed, your gut health isn't ideal, or you may be overtraining. And then other things like nutrient status. We talked about vitamin D. Before you take it, check to see what your levels are. Most people in the UK, in the northern regions of the world, have low vitamin D. It's easy to get it tested. Vitamin B12, it's an important one, especially if you're vegan or vegetarian. It's more difficult to get it and absorb it. Ferritin is a store of iron, and we test our athletes a lot. And the one thing that I've found over the last few years is, on the whole, iron and ferritin levels have been dropping. And most likely reason for that, I think, is that people have adopted a less meat-heavy diet. So they've moved from eating meat to eating more vegetable produce, which is great. But unfortunately, the vegetable produce is less good in terms of iron. And therefore, they come to me and they say, I'm feeling a bit tired. And I look at them and I'll almost kind of think, I think you've changed your diet. Let's check your iron levels. And so ferritin is basically a reservoir level. It gives you an indication of how much have you got in reserve. When your ferritin starts to drop, you haven't got a lot left. So sometimes you need additional iron, either in the diet or potentially from supplements.
You know, James, I've heard exactly the same at a lot of aesthetic conferences because low iron level affects skin health, nail health, hair health. and they talk about pandemic of anemia in
Yes.
our
Yes.
lifetime, and it's maybe related to how food produced or what we eat, but it seems to me a very common problem.
It's a really common problem, and this is the thing that's important to know. There are two types of iron, if you like. There's heme iron and there's non-heme iron. And the difference is heme iron is animal product.
Yeah.
Meat, beef, especially liver, things like this, which not many people eat these days. Non-heme iron is the iron that you will get from certain types of vegetable. The difference between these two types of iron is quite considerable in that heme iron is easy for the body to absorb. And so when you eat a heme-based iron, your body absorbs it easily and it goes into your system, it gets stored in your liver. If you eat non-heme iron, it's much more difficult for the body to absorb non-heme iron. But you can do something to help that, and that is you take your non-heme iron with some orange or vitamin C, because it helps the iron to absorb. The second thing is, if you are going to take an iron supplement, take it on an empty stomach. Don't have caffeine at the same time because it inhibits its absorption, and have it with vitamin C, at least 500 milligrams. That will improve the absorption of your non-heme based iron supplement if you're taking it all with the vegetables. So, but the first thing to do is, are you actually deficient? And the way to know that is, like we're talking about here, to do a test. Other things potentially would be a thyroid panel, especially if you're feeling a little bit sluggish, under the weather, you're feeling quite tired a lot of the time. A thyroid panel is very useful. Thyroid, obviously, thyroxine controls your metabolic rate, but thyroid panel, definitely something if indicated. There are a few others, add-ons to consider. We talked about magnesium earlier. There's a test we call red blood cell magnesium, which gives you an indication of the longer term amount of magnesium you've got. Not just the serum magnesium, it's like checking glucose in your blood versus your HbA1c. Red cell magnesium gives you an indication of what your level's been over a period of time. So it's better. And then folic acid, I'd say, is another one. We did talk a little bit about menopause and perimenopause, and of course, you know, that can be a really tough time for a woman. Blood tests for this, your GP can do, or a specialist who specialises in menopause.
It's very difficult these days to get to see a specialist, James,
Yeah.
especially on NHS. I think it's almost like the mission to go to space.
Yeah, and do you know what, Ollie? I don't disagree with you, but I think the dangers of just going out and getting a blood test, if you don't know how to interpret that in terms of menopause, I think is tricky. So you need to spend a little bit of time, and like I say, perhaps we'll go and talk a little bit more about this at another time.
But in any means, I have never encouraged to just go and do it yourself. I think there is alternative roads, like finding private clinics and try to, personally, I would say maybe detect the problem earlier. That is always the best solution.
Sure. So I think the other thing to say about bloods is it's not a single result. It's a pattern over time. So we talked about there are certain things that you can do that way maybe you're a little low in your vitamin D. You'd need to then know that if you're taking additional vitamin D, is it helping? Is it raising your level back up to a normal level? The same with iron and ferritin. So how often should you do it? I would say annually, every year. It'd be useful to get a basic blood panel. Especially if you're the type of person who wants that insight into your inside health, if you like, call it inside tracking. So yeah, I would do it every year. And then there are certain blood tests which are indicated at certain times. Again, that would normally be at the after discussing with your physician. So hopefully that's helpful.
Oh, I think it's very helpful and so detailed, and I think also broke down to simple steps. I think so. That's wonderful. Thank you, James. And James, that is a very, I think, interesting question that many people out there would benefit from finding their answer from someone who has real insights and understanding of how our bodies store fat and how actually we can lose weight in a healthy way. It seems today a lot of people trying to find solution in quick fix, and that is through the drugs such as Mounjaro and Ozempic. And my personally as a healthcare professional worry that some people buy these drugs online and they not necessarily even do a baseline blood test. I'm not even talking about monitoring it through the course of treatment. Some do through the doctors, which I think that is absolutely right way to do so. But what is your opinion with regards of those medication? Are they good? Is it benefits outweigh the side effects, or is it the other way around? And how safely people can approach this road?
Lots of questions there.
Yeah, I know.
Okay, so these drugs, Ozempic, Wegovy, Mounjaro, they have become spotlight drugs, I call them. So they've exploded into the spotlight. And because of social media, we've all heard of celebrities taking them, dropping weight fast. And maybe, you've wondered yourself, or some people have wondered, should I be taking this?
I never wondered about that.
Let's take a breath though. Let's take a step back and we'll understand a little bit about, first of all, what are the drugs, how they work, and also let's look at what everybody, whether they're medicated or not, can learn about appetite and cravings, because it works around appetite and cravings. And we need to learn to eat with a little bit more awareness. So, Ozempic, Mounjaro, these are part of a class of drug. We call them GLP-1 receptor agonists. What does it mean? GLP-1 is a hormone. When we eat, your body produces it. It tells your brain, hey, we're full, stop eating now. It also slows down how fast food moves through your stomach, so you stay fuller for longer. So it delays gastric emptying. Your stomach's sat up here. It's connected to your esophagus, so when you swallow, the food goes into your stomach. Fast food and processed food shoots straight through. So you tend not to get that feeling that you're full. And interestingly, it also takes about 20 minutes for your body to realize that you are full. Now, in the world that we live in, there is a typical thing, I'm going to get food to go. I'm going to go and get that to go. Yeah, I want that to go. I'm in a rush. I need my sandwich. I need to go quick. The problem with that is your body never really understands when it's full because you haven't given it a chance. So these drugs, they slow this gastric emptying. They also make you feel full by impacting how the satiety feeling, the hunger. So the end result is people feel less hungry. They eat less overall. They don't crave food as much, especially highly processed foods. But they're not fat burners, and they don't magically melt fat. All they do is they turn the volume down on hunger and cravings. And it's that we have to understand a little bit more so that we can understand what hunger is. How do we control it? How do we feel hunger and also feel like we've had enough? What is it we can do to almost help ourselves without the need for these drugs? And there's certainly a lot we can do. Okay, so let's quickly talk about appetite. Appetite isn't physical, it's very emotional. Because that's where it is interesting, because appetite isn't about biology, it's about psychology. And it's about habits. Most of us don't overeat because we're starving. We eat because we're tired, we're stressed, we're bored, and there's food everywhere. You know, if we walked out here, there would be somewhere where you could get food really quickly and easily. And usually it's ultra-processed food, and ultra-processed food is designed to bypass your natural satiety signals. So it bypasses the fact that your body's trying to tell you you're full. It doesn't anymore. So ultra-processed food goes straight through your system. You grab it, you eat it, it's gone. You don't feel full. And then you see another thing on, oh, I just fancy one of those. Yeah, I'm going to have it. So you walk past the shop and you have it because you didn't feel full after your meal. Chips, chocolate, pizza, pastries, all of these things, they don't fill you up. They make you want to eat more. So part of this overeating, it's not a lack of willpower. It's that we're surrounded by foods that are engineered to hijack our normal function, our brain function. So we're not getting the signals that we should be getting, and that makes it really hard. So what can we do to curb these cravings? Because cravings are just there because you're not getting the right signals that you're full anymore. First thing to say is, like we talked about earlier, don't eat over-processed foods because they won't make you full. No matter how much you eat, they won't make you full. So they'll spike blood glucose, and then, of course, because your insulin sensitivity is not great, it then plummets down. And it drops right down, and again, as soon as it drops down, you feel like you need to eat again. And that's a craving. So stick to whole foods, protein, fibre, energy-rich carbs that are difficult to digest, healthy fats. These help to regulate another hormone called ghrelin, which is your hunger hormone, and leptin, which is your satiety hormone. So these two hormones work together, and if you eat unprocessed, lots of colour on your plate, protein, good fats, these will work normally. You won't feel like you need another quick fix. Slow down. And when I say slow down, I mean when you eat, take your time. Earlier I said the brain needs 20 minutes to decide whether or not it's full. If you're inhaling something in the car because you're on the go, or between meetings, you know, we've all been to meetings, right? You've been to a meeting, you get lunch, there's all sorts there, isn't there? And you'll eat a few things really quickly because you're chatting and you don't really feel full, so you'll go and grab a few more things. And that's because you haven't given yourself time. You need about 20 minutes to feel the impact of what you've eaten, so don't rush your food. The other thing is eat meals with a bit of structure, not on autopilot. Try and have your breakfast. Don't snack all day, don't graze at night. This confuses your body's hunger signals. Eat real meals with protein, with colour and with calm, and your body likes rhythm. It doesn't like it when it doesn't have a rhythm. And I think today we don't have that balance, we don't have that rhythm. It's been disturbed, and so that's impacted how your body responds to food. So the drugs are basically resetting your normal way of feeling full. Unfortunately, when you take the drug and then you stop, unless you've altered your habits, you'll go back to square one. So it's not complicated, but it does take a little bit of effort, but it's definitely worth it.
Well, thank you very much. Thank you very much, James. I think it's really great and detailed explanation of how it works. And some people recommend a regular blood test through when you're taking those prescribed medication. Do you agree with that, or would you say, as an expert, it's absolutely safe, get it online and have just a quick chat with the doctor and you are safe to go?
No. It's a prescription-only medication. For some people it does work very well because it improves insulin sensitivity. If your BMI is over 30, for example, and you've tried other things, Ozempic, Mounjaro, these GLP-1s, they can be useful. They can be life-changing, but they have to be under the care of a physician who is monitoring you. They have side effects, like all drugs. So I wouldn't recommend anybody bought them online. I would recommend that you reset your body, you listen to what your body's saying to you, and you exercise, you move a little bit more, you get restful sleep, you have a colourful plate, and you take your time eating, put your phone down, talk to your partner or your kids. That would be my advice.
I think it's a very sensible and good advice, and I think I have so many more questions coming as well, but as we spoke before, I think we need to allocate time for another episode.
Sure.
And guys, you can write in comments if you have any particular questions specifically with regards to fitness, performance, nutrition, because most definitely Dr. James Brown will be back as a guest on our podcast, and we will be able to answer those questions in the next episode. Thank you very much. I hope you enjoyed it and receive some useful information that you can implement in your day-to-day life.
Thanks, Olya. Thank you, everybody.
Thank you.